The Surgeon General is now pushing to get this $22 billion pandemic relief plan over the finish line in Congress. He's got this new op-ed out in the New York Times today saying if the money isn't approved, we as a country will be struggling to keep up with a constantly evolving virus that he says will keep threatening our health, our economy, and our peace of mind. The Biden administration says it might run out of money to buy enough booster shots. That's a problem, right? Since we told you at the top, the CDC has just greenlit more boosters for people ages 50 and older. So what is the context check here? Are we really at risk of running out of money for things like tests and shots? NBC's Vaughn Hilliard explains.
As questions about a potential new COVID surge in America linger, the federal government's money to cover the cost of COVID care for uninsured Americans has dried up.
You need to be compensated for the care that you provide. And so this is a risk as we move forward. Hospitals do not have the margin to really absorb this.
The federal emergency relief funds to cover the cost of hospital treatment for uninsured COVID patients, as well as COVID testing, expiring last week.
I would urge the president and Congress to find funds to continue the safety net that's provided to make sure that people have access to care when they need it, so that they can get those boosters, so that they can get testing.
The federal government posting a notice to healthcare providers that last week its COVID-19 uninsured program stopped accepting claims for testing and treatment due to lack of sufficient funds. And coverage for vaccine administration will end next week on April 5th. The federal government saying it will also stop accepting vaccination claims. In the last 2 years, the relief programs have paid healthcare providers $11.3 billion for testing, $5.8 billion for treatment claims, and $1.6 billion for administering vaccines to the uninsured. One of those hospital systems, Valleywise Health in Arizona. It received $3 million in federal money for care and another $700,000 to cover testing expenses.
Many of these folks come in very, very ill and have a long extended length of hospital stay, and require a lot of resources.
The hospital this week now charging uninsured patients for their treatment and tests.
Do you feel like your hospital system has been put in a tough situation to essentially offer care versus charge because there's a lack of funding coming in from the federal government anymore?
My greatest fear here is we see these funding sources dry up, that people do not have access to things that we know have helped us.
2 weeks ago, the White House's budget office sent a letter to congressional leaders with a warning that failing to provide additional funding for the COVID response now will leave us unequipped to deal with a future surge.
We're going to continue to use all the resources we have.
And on Monday, the Secretary of Health and Human Services, Javier Becerra, acknowledging the pending challenges.
We're going to stretch where we can, but there's no question if we don't get the resources that we need, we're just going to fall behind. And I don't think at a time when we're turning the page on this fight on COVID that we want to fall behind.
Vaughn Hilliard is joining us now here in Washington. It's great to see you, Vaughn, in person. So listen, some of this, right? I mean, the White House is clearly trying to ramp up the pressure on Congress, right? And put this pressure campaign in place to try to get them to get this relief package passed.
Right.
Is it going to happen? Like, how do you handicap it?
Just this afternoon, Democratic Majority Leader Chuck Schumer said that he talked with Republican Senator Mitt Romney. This is big because essentially Democrats, like they've been trying to do for the last 2 years, he needs to convince 10 Republicans to come on board, because it was just earlier this month that Republicans essentially were successful in eliminating the replenishing of these COVID dollars here. They said that there needs to be a better public accounting of how past pandemic dollars were spent, but also to make sure this new money was offset here. So when does that happen, though? That's a big question mark. Again, because these past funds have already run out.
So Senator Schumer talked with Senator Romney, but Senator Romney is just one Republican, not 10.
You got to get 9 others.
Think they will?
That's a big question mark here. Of course, in the House, Speaker Pelosi has been vocal on this, and you've heard now from the president. And now the question here is whether they can get those other 10 Republicans on board.
Vaughn Hilliard, great reporting. Good to see you.
You too, my friend.
Thank you very much for bringing that to us.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.